Hey, good afternoon and welcome to EliteHealthOnline.com. My name is Clay. I'm the co-owner of EliteHealthOnline.com. And we have guests with us, Sadia from Texas Star Pharmacy, lead pharmacist there. Welcome, Sadia.
Thank you so much, Clay.
Yes. So, as always, these podcasts are for educational purposes only, not meant to diagnose or treat any condition. You can definitely look us up at EliteHealthOnline.com. Click there and book a telehealth appointment, receive treatment in the mail within 24 to 48 hours. But today, for Sadia, we've got a topic that I think a lot of women will find interest in. There's lots of stuff been advertised on TV over the years, infomercials, Sunday morning TV shows about cellulite. This is a prescription grade cream that we offer at our clinic that comes from Texas Star and is compounded by you guys. Talk to us about that cream. What's the benefit? How does it work? And is it real? Because as soon as you start talking about a cream that can get rid of cellulite, everyone's heard it all. But obviously, this has some differences. Would you mind educating our audience today so they feel confident in this therapy if it's something for them?
Yes, absolutely. Cellulite, like the way you said, it's there are tons of OTC options. Plus, almost every spa have their own versions of cellulite cream. The one more specifically, prescription grade cellulite cream, is a very good combination that we are very hopeful that will work in majority of the patients. Plus, we're already getting some great reviews. Is a combination of some vasodilators. Vasodilators are the ones that improve the blood flow to the area where it's applied. And with the cellulite, the main thing is when there is an ability for the body to deliver the ingredients that you're applying in the cream form. When it gets delivered to that site, then it starts working. Majority of the time, when those creams are applied, the base that is selected is either preventing for those ingredients to get absorbed just because it's the best and most cost effective option out there. And the second thing is how much time is spent in patiently applying that cream. So plus the combination of ingredients. So there is literally three different things: the delivery mechanism selected based on the dosage form, plus the amount of ingredients that is selected, and how effectively and consistently it is applied. For example, in our formulation is a good combination of caffeine, green tea, a very not really two known ingredient, but it's called lipoic acid. It has tons of benefits when taken orally from liver detoxification point of view, but when it's applied topically, it prevents the dyspigmentation that cellulites usually have. And plus retinoic acid or tretinoin, which always helps with the new cell growth, new cell development. So combination of all those ingredients, A, facilitating the delivery, B, working its magic by antioxidant ingredient delivery, and preventing the free radical damage. Cellulites have a lot of load of those free radicals, and making sure those ingredients reach at the site and start neutralizing those free radicals actually help. And patients can tell by the way they look, the area looks, and the way they feel that yes, now this cream is finally working and it has some results to it.
That's
Um,
excellent. Claudia, just a quick question for you. So can cellulite be eliminated through exercise and diet? I know a lot of times this is people question that and say, well, I've lost 20 pounds. I still have the cellulite. Can you just
Yes, it's one
quickly
of
talk
the
about
most
that?
yeah, it's one of the most stubborn to get
Mhm.
rid of via diet. However, it definitely can facilitate the process when it's combined with topical creams.
Okay.
There are other options, especially spas. They have different types of other therapies,
Hmm.
which are non-chemical based, more of radiation, different types of lasers and stuff. That's an option. But cellulite cream, when combined with healthy diet and detoxification and exercise, surely can improve the overall outcome. But using just diet and exercise alone, cellulite is not something that they will
Right.
see themselves, right?
Typically, no, we don't see that. We hear a lot of people, we do a lot of weight loss, and people are like happy with the weight loss, but the skin, the cellulite's still there, and that's then becomes frustrating. So with the
Yes.
cream,
Uh-huh.
You explain how it works and all of that. Can the patient expect that to have to stay on the therapy, or is this something that once they achieve
Yes.
a
Yes.
level of improvement that they're satisfied with, can they discontinue?
Yes. So maintenance therapy needs to be there.
Okay.
When they're using it for two phases, right? One is the corrective phase, and then is the maintenance phase. Corrective phase in any type of therapy, including cellulite, remedy. Most important is using it minimum once or up to twice a day for at least 90 days to 6 months minimum. And depending on the area and how stubborn that area is and how big is the area, it can be even more. Now, one thing, let's say the desired results are achieved in 90 days, 6 months, or even longer, then at least twice a week type of application should be maintained to
So
prevent
maintenance.
it from, yes,
Mhm.
from developing. Yes, and then application, as I was mentioning earlier, is the key. Using the right amount and applying it in, circular clock and anti-clockwise direction with the good 30 seconds to a minute until you feel the area a little bit warm, because the heat, it will definitely help the drug penetrate better. And of course, the base we have selected is naturally enriched in antioxidants. So beside the ingredients I mentioned, there are natural herbal antioxidants that we have put together in the base itself, including some phospholipids, because phospholipids are the ones that have the highest ability to pass through the skin barrier and get into the circulation and into the desired, location. So the base is the key, and the base is rich in antioxidants and capturing all those free radicals. Definitely, we are very confident, in terms of the patient satisfaction rate with the product, as long as it's used very consistently,
Right.
as prescribed. Yes.
And so is this something that a lot of times patients respond better early on? So don't wait for this to get out of hand. If you have cellulite, it's starting to form. Would starting earlier be result in better outcomes than if you wait?
Absolutely.
Okay.
Yes, because now it's not going to be as stubborn, right? The
Mhm.
longer it stays at the site, the harder it is to eliminate from there. So
Okay.
absolutely, you're right on that.
Excellent. Any indications patients that didn't wouldn't qualify for this, or any
There
other
is
than an
nothing.
allergy to any of the things that are there,
Yeah,
but anything else to worry about?
absolutely. Yeah, absolutely. But that's exactly hypersensitivity to any of the ingredients that are usually on the label when the product is being provided. If they know they have any type of allergic response to any of the ingredients, otherwise there is no restriction in it. Yes.
Excellent. Excellent. Well, thank you, Sadia. For those of you that are out there who have some stubborn areas like this, we have this product. It's very easy to get started. Just click on our website, elitehealthonline.com. Click on Speak to a Specialist. There you can learn more, or go directly and book an appointment. The provider can write this for you and have it to your door within 48 hours. We'd love to have the opportunity to treat you. Go ahead, Sadia. It sounds
Yes.
like you had
Yeah, I
open
was
mic.
going to mention, just to go back on the pregnant women should not use it. That's the
Okay.
only thing.
Okay.
Yes.
There you go.
Yeah, yeah. I was like, oh, like, there's something that is missing. Yes. Yes. Or trying to
Excellent.
conceive or still pregnant. Yeah. So they should
Excellent.
avoid that. Yeah.
Great point. All right. Well, again, thank you for being with us, and we look forward to seeing you at Elite Health Online. Thank you.
Absolutely. Thank you. Have a good day.